14 points to do if somebody you deal with has COVID-19. Tips for helping a relative or roommate handle coronavirus effects, while safeguarding yourself as well as others. It's taken place, or a minimum of you believe it has. The little coronavirus that's causing huge troubles around the world has made it into your residence. Someone you deal with is sick and also you think it's COVID-19. They require your assistance, yet you don't intend to get sick too or pass the infection to others. What can you do? Even if you do not understand for certain, assume they have it. The lack of testing kits suggests you could never ever recognize for sure if your family member or roomie has coronavirus or another thing. However, if they're running a fever, hacking away with a completely dry, coughing, or feeling extremely exhausted for no apparent factor, it's rather possible they do. Some much less typical however feasible signs and symptoms consist of diarrhea and unexpectedly losing their feeling of odor or preference. First, call their routine medical professional's office, if they have one, or your region wellness department to report the signs and symptoms and also ask if they can get evaluated. If they can, you should help them reach a testing place. But make certain they, and also you, use a mask or fabric over both mouth and nose when you're taking them. Keep the window of the vehicle cracked open a bit to let air distribute. Even if they can't get checked right now, or you're waiting on their examination results, you're much better off taking the exact same safety measures you would certainly take if you recognize that they had the virus. Comply with this guideline consistently. Don't go within 6 feet of the sick person unless they, or you, have actually covered both mouth and nose with a mask or cloth. Stay out of the very same room as them, and also give them a dedicated space. See to it the sick person coughs into their mask or towel, or their joint or tissue, to maintain virus particles out of the air. Dispose of tissues after one usage. Clean your hands commonly as well as extensively with soap or alcohol rub. Tidy surfaces with soap or disinfectants. Don't touch your face unless you have actually just cleansed your hands. You can safely help them handle their signs and symptoms at home while securing on your own as well as anyone else you live with. When you're living with someone that you assume or recognize has COVID-19, you ought to support them literally as well as emotionally, while at the same time staying clear of getting close, touching them or touching things they have actually touched that haven't been cleaned yet, states Tammy Chong, MD, MPH, MS, Assistant Teacher of Family Medicine at Michigan Medicine. And make certain to examine them usually, either by phone or without entering their room completely, due to the fact that they can deviate for the even worse really swiftly. If you understand a person that lives alone and has signs, ask if you can help with some of these exact same things without entering their residence more than needed. Check on them frequently by phone or text, as well as deal to go down food, medications or things to aid make them comfy. Know the COVID-19 danger signs, as well as what to do if they take place. For lots of people, a coronavirus infection will lay them low for a number of weeks. Speak with their routine physician regarding what to anticipate, and also don't go to the emergency clinic unless you're told to. Yet if you or a person you cope with or know has these symptoms, ask for clinical help promptly. Difficulty breathing, upper body pain or stress that doesn't go away, confusion or cannot be woken up, blue shade in their lips or face if they, or you, have a greater threat of establishing a serious instance of COVID-19, be especially watchful for these signs and symptoms. Taking care of a COVID-19 patient in your home assume like a mix of nurses as well as hotel space solutions. For greater than 100 years, nurses and also other healthcare workers have actually followed fundamental actions to care for individuals with a contagious illness, while protecting themselves from infections. If someone you cope with has COVID-19 signs and symptoms yet isn't unwell adequate to need a healthcare facility, currently, it's your count on supply, helpful care, while protecting your health. Below are 14 means exactly how. 1. Pick an unwell space. The sick person needs to stay in a bedroom with a door if in any way possible, as well as not come out other than to go to the shower room. No one else must hang around because of the area more than absolutely necessary. Kids and family pets must avoid it. Maintain a home window open in the sick room when possible, to maintain air circulating. Offer cells. If you do not have more than one bedroom, give them the bedroom, as well as you can sleep on the sofa or various other short-lived areas like a blow-up bed mattress, so you can still use the living room, cooking area as well as various other spaces while they remain in their room too. Pick an ill shower room. If you have 2 washrooms, make one of them the sick person's washroom, as well as do not allow any individual else to use it. If you do not have 2, you're going to need to clean every surface area they touch after they go to the bathroom, so it's tidy when you or other people you deal with the requirement to use it. See cleansing tips below. And do not share water mugs. 3. Help them track their signs. Have them take their temperature level numerous times a day, without getting close to them. Make a note of the analyses, and note when brand new signs occur. 4. Help them hydrate. See to it they're consuming alcohol, a lot of water as well as various other non-alcoholic clear liquids. 5. Relieve their signs. Help them comprehend how commonly they can take medication to minimize their high temperature, like acetaminophen and also ibuprofen. Michigan medication medical professionals have evaluated the proof concerning these medicines as well as others that have actually been in the information for COVID-19. See even more info right here. Make certain the sick person comprehends how much to take. Check out the label on the bottle and follow it. If they have a poor cough, help them comprehend how much cough medicine to take and when. Don't let them take more than the suggested dose of any medication, or utilize alcohol when taking a medication that advises against it. Keep track of what the sick person has taken and also when. Make certain they maintain taking any other medications they would usually take unless their physician has told them to quit. 6. Maintain them comfy as well as entertained, while keeping your distance. Make sure they have coverings and also pillows, books, magazines, as well as a computer system or TV to kill time, and also a charger for their phone near their bed, so you don't need to go in and out of the area. Keep your home quiet so they can rest. 7. Help them with food, yet keep your distance. Discover a tray or cookie sheet that you can use to bring them food or drinks when they require it. If they can get out of bed, place the food as well as drinks on the tray, and area it outside their closed door. Leave. They can open the door, obtain the tray, eat in their area, and after that put the tray back on the flooring outside the door and also close it. If they cannot get out of bed, put on a mask or cloth over your mouth and also nose when you enter their room, and also have them cover their own as well. Bring their food and also drink to their night table, as well as go back after a while to choose it up once again, using a mask or fabric again. Wash their meals thoroughly with hot water as well as soap. Don't touch your face after managing their meals, and also wash your hands completely after you touch anything they consumed or drank from. 8. Maintain their laundry different. Bring changes of clothing as well as jammies to them if they're not already in the sick area. Obtain your garments out of the unwell area if they're usually kept there. Make sure they have a basket, obstruct, or bag in the unwell room to put clothing, towels, clean cloths, and also bedding in. Have them put it outside their door when it's complete, or wear a mask or cloth over your mouth and also nose when you enter to get it. Wash their clothes, towels as well as bed linens individually from any individual else's. 9. Clean, clean, clean. Experience your whole residence and also utilize a disinfectant spray or wipes to clean everything the sick person might have touched when they were in the early stages of getting sick, or when they were contagious prior to creating signs and symptoms. This includes tables, hard-backed chairs, doorknobs, light buttons, remote controls, handles on cabinets as well as fridges, desks, commodes, sinks, computer keyboards, and also mice, tablet computers, and also a lot more. Clean things they used or made use of in the days prior to you isolated them in the unwell room. 10. Say no to visitors. You should not be having visitors over anyway, or people functioning inside your residence. If you have to see somebody in person, do it outdoors your home, preferably outdoors, as well as stay at least 6 feet away from them. If they're bringing you something, inquire to place it down as well as tip away so you can select it up. 11. Usage technology to connect. It may seem ridiculous to do a video conversation or voice telephone call with somebody in the following area, however, it can provide the sick person human contact with you, your kids or family pets, and others in the home, without spreading the infection. Ensure they can link basically with others, also including family members, good friends, coworkers, and also faith organizations. This can alleviate the awfulness of being sick and stuck in one area. 12. Stay home on your own, since you as well as others in your house have actually had contact with somebody who has or might have COVID-19, you can bring the infection with you to work or the shop, even if you do not have signs. Tell your manager you have a person in your home with symptoms, as well as ask if this means you must stay at home or put on a mask at the office. Put on a mask or headscarf over your mouth as well as nose if you are most likely to the shop, and also make a couple of journeys as possible. Order delivery from restaurants and stores if it's offered. If you have a lawn, garden, patio area, veranda or porch, hang out there to get outdoors. However, stay 6 feet far from any person who doesn't live with you. 13. Do not hesitate to request for help or support. It's alright to let pals, neighbors as well as household know that someone you cope with is sick, as well as to seek and also accept their help while not letting them near the sick person. You don't need to tell your entire social media network, yet a minimum of telling a couple of people you can rely upon. They can bring you products from the outdoors and leave them on your front door, or deliver them to you. They can stroll your dog, though you must clean down the chain initially. Don't forget that you require emotional support and also a connection to help you survive your time as a COVID-19 caregiver. As the country functions to combat the spread of the infection, and also look after the sick, we're all impacted in some way. But getting in touch with each other and safe methods can assist us to cope. 14. After they're much better, a person who has actually had COVID-19, whether they got examined or otherwise, ought to stay home as well as away from others till a minimum of 7 days given that their signs and symptoms started, and also until they have actually been fever-free without medications for 3 days, and also their coughing or lack of breath have actually gone away. All 3 points have to be true prior to they can head out. Later, you, as well as they, ought to do an extensive cleaning of the unwell area, consisting of wiping down all hard surface areas, cleaning bedding consisting of blankets, and vacuuming.